And during this early October 2021, I had a wife of a man who was a 50-year-old sheriff's deputy. He was not local. He was north of me in Dallas, and the hospital was this Texas Chile hospital was basically said, "There's nothing else we can do," and they were discussing hospice, and she wanted him to try ivermectin, and he had tried to get it before going in the hospital and couldn't. So she decided, to sue the hospital, and she asked me to help. So I agreed. I testified along with Senator Bob Hall, and we won the case. And the hospital was ordered to grant me emergency temporary privileges and access to the ICU without delay.
If you like your healthcare plan, you keep your healthcare plan.
Nobody knew that healthcare could be so complicated.
We finally beat Medicare.
This is the Doctor's Lounge. All right, we are live today. I'm so excited to have Dr. Mary Talley Bowden here. Anyone who has been on social media for the last 4 or 5 years since COVID came out must know who Dr. Bowden is, but she almost needs no introduction. I first saw videos of her back in a while, like 2020. Dr. Bowden came to my attention in somewhere in 2020 when COVID was kind of hitting the fan, and she was like this plucky person who had these videos. She had press conferences outside her doctor's office and talking about COVID, and clearly we're aligned and moving in the right direction in terms of against some of the tyranny of the lockdowns and some of the craziness that was happening at the time. And since then, I mean, she's just kind of blown up. It's pretty obvious to see why. She's incredibly courageous. And the thing that's really caught my attention and should really get support of every physician, I don't care what politics you are, it should get every physician kind of on her side, is her battle against a large health system in her neighborhood that really has come after her. And whereas the vast majority of physicians will not even dream of trying to go at it with the local health system, Dr. Bowden, showing what stuff she's made of, she has gone toe to toe with them, and as of late seems to be winning. She's coming out on top, which is amazing. So, Dr. Bowden, thank you so much for coming on.
Thank you. And I think I'm surviving. I'm not winning yet, but I will win. I guarantee you I'm going to win. It's just
No,
I'm not there yet.
Yeah, we should start one of those betting sites, and I would definitely bet Dr. Bowden after what I've seen the last few years. But tell me, so I want to kind of focus on that first, because that to me it's so egregious what was happening. You were, in the midst of COVID, you never shut down, you never hid, you were seeing patients. You're an ENT physician, and you started taking, you started taking care of patients who had COVID. And, partly because of that, I think, and you came to be very well known locally and nationally about the fact that you were taking care of COVID patients. Somebody reached out to you who had a loved one who was an inpatient at the hospital. Do you want to tell us just a little bit about how that all kind of played out?
Yeah, so I'm a solo physician. I'm in Houston, Texas. When the pandemic started, I actually had just started my practice 6 months ago because I had 4 kids in 5 years, and I took a lot of time off. And when I went back to work, I knew I was not employable, which thank God, because I needed flexibility with 4 kids. And so I decided, well, I'm just going to set up my own shop. And in doing that, I also knew I couldn't take insurance and be a solo practitioner and survive. So I decided, well, I'm going to try this model where I call myself third party free, because I don't contract with insurance companies, hospitals, or the government. And, the only people I work for are my patients. And that allowed me to push back more than the typical doctor. So yeah, because I'm ear, nose, and throat, I started seeing these patients with these stubborn respiratory tract infections. So a lot of people, they'll get sick, and when they don't get better from their primary care doctor, they go to the ENT. And then, I started offering monoclonal. Well, first I started offering testing for COVID patients. And the reason that came about was I was using this lab called Microgen DX, which does PCR testing for bacterial and fungal infections of the sinuses. And they came out with a saliva test for COVID, a PCR saliva test, which was great because you didn't have to have anything jammed up your nose. And I have my practice set up in a strip center. So patients would just take a cup to their car, spit in the cup, leave it outside the door, and then we'd have the results back the next day. So I became known in town as a place to go for, a swab-free test where you could get the results back the next day, because early on it was taking a long time. And that's how it all really kind of started with the COVID stuff. And then I started offering monoclonal antibodies, and I didn't restrict them based on gender or sex or race or I just said, come one, come all. And they worked super well. But then the government took over distribution and they became really hard to get. And that's when I started using ivermectin. And I was actually worried about using ivermectin. I didn't think it would work, but I made sure it was safe. I dug into that deeply. And then I started using it, and I found that I was still able to keep patients out of the hospital despite not having the monoclonals. Well, I had privileges at Houston Methodist. They were the first in the hospital, first in the country to mandate the COVID shots. This was 5 months before Biden, April 1st, 2021. And I had a good relationship with them at the time. I was collaborating with them on research because I was doing so much testing. I was collecting all this data, but I needed somebody to help me with all the data because I was just so busy and I didn't have all the resources. So we were collaborating, and then I started noticing a trend. I'm like, wait, what's going on? Are you seeing what I'm seeing? This was the summer of 2021. Like, all these people are getting sick who have been vaccinated, and they basically gaslit me and said, basically dismissed me. And so I started speaking out on social media. Things really heated up in the fall of 2021, and that was the third and largest surge of the pandemic. This is following, the rollout of these miraculous shots that were going to save the world. People were just going to the hospital more than we'd ever seen. And then during this was early October 2021, I had a wife of a patient man who was a 50-year-old sheriff's deputy. He was not local. He was north of me in Dallas, and the hospital was this Texas Hugley Hospital, was basically said, there's nothing else we can do. And they were discussing hospice, and she wanted him to try ivermectin. And he had tried to get it before going in the hospital and couldn't. So she decided, to sue the hospital, and she asked me to help. So I agreed. I testified along with Senator Bob Hall. And we won the case. And the hospital was ordered to grant me emergency temporary privileges and access to the ICU without delay. Well, they defied that court order.
So you went, Mary, you had time to go to court, do an emergency hearing, and some judge said to you, you have emergency privileges to treat this individual.
Yeah. And it was all over Zoom, of course, the hearing, because no one would get near each other at that time. But yeah, and I don't know if you remember at the time, it was the privileging process was streamlined, so it wasn't you could easily do it the same day. Well, they made me submit letters of recommendation, a 2-year surgery case log, even though I was not operating on this man. And I got this all. It was like I can't remember, but 20 to 30 page application. You know how those things are.
Yeah.
They're horrible. And my clinic is just going crazy because they're all, so many COVID patients. But I got it done because some man's life is on the line. And I submitted everything that needed to be submitted. Well, they said, we're denying your privileges. And I had a clean record. At that time, I had a good reputation, and I've never been sued for malpractice, but they just fought tooth and nail to prevent this man from getting ivermectin. And they actually turned me in the board when I testified. So they didn't like my testimony, and they turned me into the board. But then they went on then they turned it into me sending the nurse without privileges. But, my defense is I had a court order, and I had the lawyer telling me, yes, you can go. We're all good. I mean, so it was.
So they reported you to the medical board when you testified in court, saying you believed this individual would benefit from therapies that you can give him.
Yes. As part of and the lawyers on this case, they did 189 cases like this. So they were very experienced.
Mm,
And so they had sort of a strategy. And part of the strategy was find a doctor outside the hospital
I
that
see.
was willing to write the prescription for ivermectin and get that doctor privileged in the hospital, and there we go. And I was the only one of those 189 cases where they turned me into the board, and it's gone on this long. None of the other doctors went through this. But I think it's because I've been so vocal about it that they're just not going to back down.
Yeah, forget about, I think a lot of folks get hung up. I really think this should be a moment of unity for all physicians, because it doesn't matter whether you're on the left, on the right, or whatever. I mean, at the end of the day, this is a clear abuse by a health system about using this privileges, reporting to the medical board. This is vindictive, vengeful. It doesn't matter. It doesn't matter if you think, ivermectin, if there's some physician who thinks ivermectin doesn't work. That's completely, I think, irrelevant. I mean, you believe that it works. It's not like you're trying to give the patient cyanide, right? I mean,
Right.
okay, if you're trying to give something that's clearly dangerous, that's going to end their life in some fashion, okay, fine. But like, we have disagreements in cardiology all the time. It's like,
Right.
no, I don't think this person should get Xarelto. Oh, you do think this person gets Xarelto. I mean, and you would never use a disagreement like that to then say, hey, we're going to try to hurt this individual. We're going to get him kicked out of the hospital or whatnot. To me, it's an irrelevant distinction about that people seem to want to make about, oh my God, why do it? What about this notion? Is there anything in there about having to see the person or go in and visit the person? I mean, I thank God you didn't go there. My God, what would they have done to you then? I mean, all you did was send a nurse there. They turned the nurse away, right? And there was no
Well,
altercation.
they
You
called the
weren't.
police on the
Oh my
nurse,
God.
and it was she videotaped the whole thing,
Yeah,
and it was
yeah,
very calm. It wasn't like she barged, tried to
right.
barge into the ICU. But they called the police on her, and it turned out that they did have a stay on the order, but we did not know that. But I have all
Okay,
that documented because
right.
basically the order went to the spam folder of the Prohoc Vice. But we also think it was a trap because
Mm.
my lawyer talked to their lawyer before I went, and they didn't say anything about the stay. So we think they were actually purposely quiet about it to try to trap me and get me in trouble.
Right. So, but that's the thing. Go ahead, Anthony.
No, I was just going to ask. I mean, there's so many methods that large health systems can use to retaliate against physicians. I mean, you've obviously going to the state board is one. Do you know, did they utilize the National Provider Data Bank? I don't know how many of our
Oh, yeah.
listeners are even aware of the National Provider Data Bank and how large health systems can utilize that to weaponize against physicians. They have so many levers to use against us, and we really don't have any to use back against them, which is why I'm so astounded at your courageous effort here.
Yeah, so when Methodists came, so when I started speaking out against mandates, and so it was weird because this all happened on a single day. I got my privileges denied by Texas Hughley Hospital. I had a patient call me, and she was very distraught because she said that her urologist at Houston Methodist was not going to see her anymore because she was not vaccinated. And then I got a notice from a surgery center that I would have to get the COVID shot to maintain my privileges there. And so I fought back. I wrote an email to my patients, and I said I was going to prioritize seeing the unvaccinated, and related why. And that really triggered people. And I never upheld that. I was just trying to make a statement. But then I went on Twitter and posted 25 times in one day. I just said vaccine mandates are wrong. And then I put a screenshot of responses to that email from patients, grateful, saying thank you. And then they came after me and suspended my privileges, and they went to the press. So they went to the Houston Chronicle. I got a text message from a reporter at the Houston Chronicle saying, can you please verify that your privileges have been suspended at Houston Methodist based on comments you made on social media? So, that was a huge gut punch. And I resigned because of how they did that. And then they turned me in the National Practitioner Database and the medical board because they said, oh, you can't resign while you're under investigation. But their bylaws to be under investigation has to involve a patient. So they're technically they can't do that according to their bylaws, but of course, that doesn't matter to them.
Yeah, it's so frustrating that I mean, I don't think patients have really much of an understanding of how incredibly powerful health systems are, and the fact that if you go against them, they absolutely will attempt not just to kick you out of their hospital, they will attempt to end your career. And that's exactly what they try to do to Dr. Bowden, is that they it was not enough to strike her from the rolls of Houston Methodist, not like she ever wants to be affiliated with Houston Methodist ever again, given their actions, right? No, they have to report to the National Practitioners database, which then you have to now report to every single other place that you try to get privileges at, which has impacts on whether or not insurance companies will take you, right? And then comes the thing we're going to get to next, which is in a little bit, which is the Texas Medical Board and that whole battle that then kind of ensued. I mean, we talk a lot about health systems here and these nonprofit health systems and how predatory they are and how unhealthy they are for the ecosystem. I can't, this story by itself is a great example of how kind of diseased these systems are. Was there a lawsuit that Houston Methodist, did Houston Methodist come after you beyond the reporting to the Texas Medical Board, as well as
Well, I sued them for
okay.
defamation and I lost. Unfortunately, my attorney had a stroke during all this, and he made a technical error that was that we could not recover from. And I appealed, but it was because I didn't sign the affidavit, and they didn't put my birth date or something, and some stupid and I basically was told you can't go on from here. So I wrote Houston Methodist a check for $166,000. Now they're fighting me because they want interest on the money, even though we had negotiated. So my lawyer had negotiated with their lawyer the final sum cost. We all came to an agreement. I signed the settlement agreement. I mailed them the check. They cashed the check, and now they are claiming I owe them an additional $25,000. We're still tangled up in court.
Got it. It just galls me that these are these nonprofit systems that we have given tax shelters to, that we send all this massive amount of money to. Anthony, the favorite topic is going through the Dutch and Dutch Rojas as well. A favorite topic is going through the 12 different ways that we are shoveling money at these health systems, so they can do what? So they can take upstanding members of the community who are trying their best to take care of patients and sue them. It's really quite ridiculous. Like I said, this alone tells you why we have to do something about these systems and how powerful they are and what it is they can do. So that's one saga that you're still battling. The interest is so ridiculous. The other saga, which has now taken on, I would say, like a bigger life of its own, is this Texas Medical Board, right? The medical boards they exist and are created in order to safeguard the public from, this is one of their primary missions. I know they do many things. One of their primary missions is to safeguard the public from dangerous doctors. Okay? I mean, Texas is the state. I think I'm getting this right. Where there was a spine surgeon, right, named who's colloquially known as Dr. Death, correct?
Christopher Dunch, yes.
Christopher Dunch, yes. I mean, there's this crazy podcast series, and oh my God, makes doctors look so horrendous. I mean, spine surgeons are some of the most talented folks that exist, and they go through this massive filtering process. Somehow, this crazy guy gets through this massive process, has no idea what he's doing, and literally paralyzes or kills some ridiculous percentage of the folks he's at. And this is, and he does this over a period of time. This isn't like 1 month something bad happened. This is over a significant period of time at multiple different hospitals. And he's only stopped by the local people at his hospital, not the Texas Medical Board that eventually stops him. And so in that, again, they're supposed to safeguard the public from dangerous doctors. In what exactly is their problem, Mary?
Well,
why are you embroiled in something with them?
I'm embroiled. I mean, the sensible thing for me to have done is just paid the fine and moved on. But I was just, I'm fighting on principle, right?
Yeah. Well,
I mean,
Well,
They
tell me
what was the
what was they yeah what do they want to censure you for? What do they want to do to you?
Well, it was all over the patient in, the ICU at Texas Yearly Hospital. And there were 4 accusations to begin with. One was not establishing a doctor-patient relationship because it was done over telemedicine, which is complete BS because everybody was doing telemedicine at that time. One was prescribing a dangerous drug. One was I can't even remember now. But basically, they had to throw everything out, and it all boiled down to them saying that I did not have privileges when I sent the nurse. They could not find an expert to testify against me. The first one got cancer. The second one just chickened out because I was being so vocal on social media. And then the third one, uh, he had to submit his CV to as part of the court filing, which I don't think I scoured his CV. And it turned out he had been working for Planned Parenthood for the last 12 years. And he was the medical director of the Texas Medical Board, which, that doesn't fly in Texas, right? And so I exposed that, and he pulled out of being the expert witness and quickly resigned from his position with the medical board. So that is a big victory for me, if nothing else. But yeah, they issued me a public reprimand, which goes on my record. And initially, they wanted me to pay $5,000 and take 8 hours of CME and then retake the jurisprudence exam, which in Texas, you have to take a legal exam to get a license. And I already passed that, but they wanted me to retake it. So, I mean, a lot of doctors got attacked by the board over ivermectin in Texas, but I'm the only one that really fought back. And so now in December, they issued the public reprimand. It's been wrapped up in the executive branch, so in the administrative courts. Now it goes to the state district court, which is the judicial branch, which might be more fair because you don't really have a fair shake in the administrative system. The odds are really against you as a defendant. But when I took it to the judicial branch, basically it's a law. It's not it's a lawsuit against the Texas Medical Board. Generally, the attorney general would defend the medical board, but he came out, Ken Paxton, and said, "I'm not defending you. You're going to have to find your own lawyer." So that was a big win for me, too. But it's still out there. The medical board came back, and they don't have a lawyer, so they haven't been able to issue any kind of response. And so they sent an email to the 100,000 doctors in Texas saying that they are fighting me vigorously because they want to protect patients from doctors like myself trying to treat patients without privileges in a hospital.
Dan is running the Choi Empire is growing over in New York. He's taking over spine surgery in his little section of New York, so he's always busy. So good to have him. Dan, I know you work a lot with health systems around you, and you have, I'm sure, a collegial relationship. All of us try to keep collegial relationships with the health systems around us, right? I mean, nobody wants to pick a fight. What's on this, the use of privileges, on the use of, to kind of force you to, do things or to kind of shape what you do or how you do things?
Yeah, Dr. Bowden, it's an honor to meet you. I've seen your fight on social media publicly, and you are championing kind of the essence of our profession, right? Why most of us went into being doctors is we cherish the scientific method, which is, what is the scientific method? It's asking questions, and you shouldn't be punished for asking questions and challenging the prevailing, this is dogma, right? I mean, you've seen the medical profession, medical knowledge has only evolved by people who were called crazy, right, by the mainstream, right? If you talk about total hip replacement, John Charnley was scorned by the entire medical profession. You're crazy. Like, these things are going to fail. You're committing malpractice for implanting these devices. But we live in America, First Amendment, freedom of speech. We should be able to speak. And you were not maiming patients. You were trying to help them. And that I think is resonating with Ken Paxton, with the broader community, people who have access to, your actual testimony and what you're saying. And unfortunately, look, I think stories like yours are what chill freedom of speech within the medical profession. And what you've seen, especially since the AC has been passed and there's been massive healthcare consolidation, and you have a hospital independent medical staffs that have no longer become independent, right? They're just a proxy of a group of employed physicians that, basically the people who get put into power typically are the ones who are most pliable to hospital administration. And we've all witnessed that, I think, in our own hospitals. My practice is unique. A lot of independent doctors who don't want to work in hospitals, just avoid the hospitals. They work at ambulatory surgical centers. They work at our outpatient offices. Unfortunately, I'm a hybrid. I have inpatient cases I have to do in the hospital. So I walk in, I interact with the hospital. I'm very careful, nice to everyone, nice to the nurse, nice to the tech. But there is always that worry that if I speak out against something I see, and I know this happens with across the board, even and probably worse, I probably have more of a voice as an independent physician than my employed colleagues. When my employed colleagues see something, they can't say anything. They see something, they know that there's repercussions if they speak out. I mean, if there's someone like you who just gets hammered into the ground with infinite resources, these guys have deep pockets and they want to make an example of someone. They do, right? At the end of the day, when they make an example of someone, then there's more compliance amongst those who they employ and they have a contract with. So I applaud your fight. We're rooting for you here, those who really believe in physicians being an independent profession. And we really hope you prevail.
Thank you, especially coming from New York.
The makeup of the Texas Medical Board, is there something about the particular makeup of this board? Is there politics involved in all of this? Mary, what do you think?
Yeah, we have two different. Yeah, I mean the whole pandemic became very political, and yeah, for the record, I was not political at all prior to COVID. I barely voted. I avoided people that were into politics, so obviously that has changed. But there are two types of Republicans in Texas. They're the ones that pretend to be Republicans and to pretend to be independent, and then there are ones that are really truly independent thinking and free thinking. I think the mandate started in Texas very purposely. They knew if they could get away with mandates in Texas that they could get away with them anywhere. And so I think that healthcare has sort of changed the politics of Texas because we have the largest medical center in the entire world, and it brings in people from all over. And our economy, people think of it as oil and gas, but our economy is actually dominated by healthcare. And I think it has changed our state politically.
Is it changed because of who has, meaning what how is it possible that the governor is Greg Abbott, right? He's a Republican. I mean, all down the line. I mean, you have Ted Cruz. I mean, you have all these like Republicans. And again, you have even if say they're Republicans in name only, say the base that they're appealing to, I don't understand how it is that this is kind of happening. Any ideas living in Texas how this is happening? Like for instance, the Texas Medical Board, right? Are the members of the Texas Medical Board, like, who are they, and what's their general ideology? I mean, clearly it's not great given what's happened.
Yeah, most of them are kind of private. Believe me, I've been digging, and they do. There's not a lot. They don't reveal a lot about themselves online. So I'll start with that. I don't know. I found one of them did vote for this really radical Democrat, or donated money to a really radical Democrat. But, the head of the medical board donated $80,000 to Greg Abbott. So we know why he's up there. But it's like I said, it's like they're these fake Republicans that, when it came, I think COVID was a litmus test in a lot of ways for how independent minded you are. And most of those people in power, the Republicans, failed it. I mean, Greg Abbott did nothing. He let Houston Methodist do the mandates. He didn't say anything until he was really pressured to do it in the fall. He didn't help me. He was well aware. I mean, I know I had people in the Senate and the House vouching for me and trying to get him to help, and he didn't. And you see this divide. Like, Ken Paxton is sort of the other side of that. You have, Ted Cruz would be sort of considered on you may not be familiar with all these nuances, but Ted Cruz his house is like 3 blocks next to my old office where all this was going down. And he never stepped in and said a word. But there were a handful that were very vocal and very supportive. And, I started an organization to prop up the politicians that, were like-minded and will stand up And my goal is, to try, basically, I don't give them any money, but I try to give them social media presence and give them free PR to try to, get more people like that in office.
Is that the path forward? Do you think the path forward is to get do you find the general folks that you talk to, I imagine you have a lot of popular support within Texas. You certainly have a lot of support nationally, but I imagine that like the rank and file Texan is supporting doctors being independent and free and whatnot. And so is the path forward to change the type of politicians that are out there? Is that what you've kind of, I mean, I know there's many different lines that you're pushing forward. Of course, you're fighting the Texas Medical Board. You've been very active now in terms of pushing folks that really walk the walk and not just talk the talk. But is that the path forward in Texas for you?
Well, we've got on the federal level, I feel like it's sort of a lost cause in a lot of ways. It's just so fighting locally, I think, is easier and probably more effective. When you start looking at it, I mean, there you can see, like, for instance, last session or maybe 2 sessions, 2 years ago, there were 7 states that proposed a ban on mRNA shots, which, that would never. Obviously, it's not going to happen federally, but that effort's growing. We've got more and more politicians interested in making that happen. It just seems easier to work on it locally.
Local level.
And although ideally, the FDA would be acting the way they should, but they're not. So it has to become political. And yeah,
So I
I've
was
learned. Sorry, yeah, go.
Sorry, I didn't mean to cut you. I, is it? Do you think we need to widen the Overton window in terms of what's acceptable? Just like Dan was talking about, and this has happened, by the way. Every single early generation of physicians who's doing some wacky thing that turns into the establishment. Right, the first time they do it, it's like, what are you doing? And let's eliminate you and let's try to stop you. And then of course it becomes consensus. Isn't that a sign that we are? As physicians, as a group, historically, we've just been too narrow-minded in terms of what we accept. And I find myself doing this all the time too. Like, I have very strong opinions about what I think is correct in, say, cardiology, correct? But do I necessarily want to go after somebody who believes diametrically opposite about me in terms of the workup of, say, chest pain in the ER? Like, is it better to have somewhat more of an acceptance? So take vaccines, for instance, which is, should we, as a independent libertarian type of place we should be pushing towards, do we want to set up a system where, Mary, half the country wants to boost every year? Should we go ahead and have a system that says, okay, you want to boost every year, go ahead? Or should we have a litmus test? Should we have a litmus test that says, well, if you are for that, let's, then you're a problem. Like, are we not then becoming the people that we, yeah.
Wait, were you in practice when Vioxx was around?
I was, yeah, no, I was, yeah, absolutely.
So, I mean, imagine if Vioxx were a choice and we were giving Vioxx to 7 million children, right? Because, just because politically people are so blinded by, but this shot is, I mean, there's no upside to the shot. And I mean, they're giving it to children. 7 million children have gotten it this season. I mean, I've never seen anything like this. And I've practiced through Vioxx. I practiced through Trovan. I think that was the antibiotic. I mean, there've been other products that have come and gone. I see the carnage every day in my office. I mean, it's like, I saw somebody yesterday a new patient who has had hives for 4 years, onset 3 days after her second shot. And she's like miserable. And
yeah.
I see it all the time. I've never seen anything like it with any other product. I just think ethically, it's unbelievable to me that we're giving these shots to people. There's no upside.
Can you tell us more, Mary? Can you tell us more about what you're seeing in your office? I think that not enough people are necessarily hearing this. It's not in the literature per se either. So can you tell us what you're seeing? And do you know of any efforts to collect this data and report on it in the literature?
There are go to react19.org. They have over 3,600 peer-reviewed published studies of issues with these COVID shots. Okay. It's not like there's no literature out there. I mean, just like any other issue, you can find a study to support anything you want, and you can find a study to disagree with anything. I mean, but I will just say firsthand, I am seeing it, and it is, I'll see these strange rashes that don't respond to antihistamines and steroids. Like this patient that I saw, the only thing that was working for her was taking Allegra, Zyrtec twice a day and Pepcid twice a day to have any kind of relief. And she said steroids didn't work at all. But, rashes, I see neuropathy. I see strange, severe pain in one area of the body that doesn't show up on an imaging study. I see POTS a lot, where their well, you know what POTS is, but blood pressure fluctuations without any trigger. Now, I don't see, myocarditis and stroke and that sort of thing because I'm outpatient, but I see, these people where, I mean, they are sick. I see tremors. So I saw a 50-year-old woman she's a marathon runner, and the arm in which she got her shot has not stopped shaking since she got the shot. Yeah, things like that. And
Yeah,
they're
no,
very difficult to treat. They don't,
yeah.
I mean, it's trial and error, and it's frustrating, and they get gaslit. None of the patients I've seen for injuries have been reported to VAERS. None.
Yeah.
I've been the one
That,
reporting to VAERS.
that's kind of the problem is that to report vaccine injuries, you have to go through the VAERS, and then they have to attribute it to the. I mean, these, not to say that these people are making things up, but there's other things you could be. I mean, I work in a low back pain clinic. I get people blaming every problem on earth on their their herniated disc in their back is the reason their hair hurts, right? So who knows? And it's impossible, right, to make those determinations post hoc on whether or not this was vaccine caused. I think it's tough. So, again, more
Well,
kudos
this
to
is
you
the way
for
I
what you're
look
doing.
at it. It's diagnosis of exclusion, right? And onset of symptoms and taking a history. And what's bad is, most of the time you don't really find anything on blood work and imaging to reinforce it. I mean, the only thing that I'm finding that's weird is these antibodies to spike proteins. I've compared the patients that got shots to the patients that did not get shots. And on average, the patients that got the shots, the spike protein antibody level is about 1,300. And the patients that got the shots is about 13,000. But that's even an underestimation because 7% of my patients, they're off the chart. They're over 25,000. And this is 4 years after getting the shots with no recent COVID infection. I mean, it is weird. It does not make sense. And it correlates with their symptoms. Now, I don't have it published and all that, but I know there is one study looking at that, but there's not a lot of diagnostic data. And so you have to go by history, you have to go by diagnosis of exclusion. But I definitely am seeing real injuries, and they've been completely abandoned by the government. They only have 1 year to file for a claim. I think the last time I checked, 97% of people who applied for a claim were denied. Like I said, I've never seen anything like
Yeah.
this.
The
And I know,
Right.
I attract the people that are injured, and you guys probably aren't seeing what I'm seeing, but
It's that, yeah. No, so
it is
the issue,
not subtle.
right? No, yeah, but no denying certainly what you're seeing. The issue is, of course, you have you see the ample number of doctors that come after you on social media, right? That are like, no, Terry Simpkins, that I don't know where he came from, but he emerged from somewhere and he's now the truth teller, and he's like, no, I've got my 40th shot and I give it to everyone. So the point is, if say that there's some percentage of doctors, maybe if Vioxx was still around, right, there'd be some percentage of doctors that would still be like, no, Vioxx is great and we should be using it. And somebody has to determine some
Thalidomide.
threshold, right? Clearly, in the case of the COVID shot, and it could be political in terms of why folks are so dug in to still continuing to get these things, given the fact that to me it's like, well, I don't understand. The last time somebody got severely ill with a SARS-CoV-2 pneumonia was God knows how long ago that we saw them in the hospital. So what exactly is the upside here? But regardless, you have some group of physicians that are highly motivated to do it. So,
But
doctor,
I will
yeah,
say, okay, just sorry to
yeah,
interrupt,
yeah,
but at the last ACIP meeting,
yeah.
and this came from the CDC, they said only 10% of healthcare workers are actually getting the
Yep.
shots.
Nope, no
So
question.
I think there are actually
Yeah.
more people out there that have seen the light than
Yeah.
there's
No.
a handful of people that are very vocal on social media about how much they love these shots. But in truth, the majority of doctors are not getting these shots.
Yeah, no, completely agree. I think because, yeah, and I think the market would just, this is what I mean. The market would sort it out. So you don't even need to necessarily pull the shot from there. I mean, it's like, what is the point of
But
taking
the
the shot?
children, I mean,
The
the
children, yeah.
children, 7 million children,
Are still getting, yeah. Right.
they can't decide for themselves.
Yeah, no question. I guess it's the question, Mary. Well, what does one do? I mean, I'm sure, like, it's the whole. What does one do when you have some disagreement? Because a bunch of experts will disagree on things. I kind of come down on the side of saying, okay, I mean, if look, it's like grades, right? It's like if you have a physician that takes off a limb of a child that is completely functional and normal, that is different than, say, giving your 15-year-old boy a second dose of the mRNA vaccine. I think no boys, since we found out in the fall of, or spring, April, May 2021, no boys should have gotten a second shot of the mRNA vaccine. Like, that was, it was crazy, I think, to do that starting then. And I still think that would be crazy. But it's a relative risk in terms of getting vaccine myocarditis versus taking a healthy young child who's coming in saying, I want to be a pirate and therefore I want my leg cut off. And some surgeon actually going ahead and doing it. So there's like this, there's this big scale and range there. So I think that's somewhat what's difficult.
It's much easier as a doctor to be vocal about that. You will get much less pushback. It is safe. That's very safe. It's still, I mean, I think it's safer, but it's still problematic to speak out about the COVID shots, which shouldn't.
Yep. No, and it shouldn't be, and it really shouldn't be, and that's absolutely the case. All right, next topic. What Casey Means? Your thoughts on Casey Means? I know you've been very vocal about Casey Means. What are your thoughts on her?
I had an open mind at first because she's an ENT. She went to Stanford. I went to Stanford. I reached out to her on social media because she followed me and she stonewalled me. She wouldn't respond to me, so that prompted me to start digging. When I just that raised my antenna.
Mess with Dr. Bowden. If she reaches out to you, sex her back immediately.
It was very nice. I was like trying to get along, and I wasn't trying to fight with her.
Just kidding, yeah.
But it just caused me to sort of, well, that's weird. And so then I started looking at all her posts, and she's very vocal about health, but during the entire pandemic, she didn't post anything about COVID. That seemed very weird to me. So, yeah, I think she's a little bit fake. I think, it is a big deal to not finish your residency. I can't tell you how many times I wanted to quit, and I toughed it out, and it was a rite of passage. There are 1 million doctors in the United States who finished their residency that they could choose from. I do think it matters that she didn't finish, and she's very articulate, but I mean, there are other options that I think would do a better job. Yeah, I mean,
it's so interesting that on the right, the right is so much less monolithic, right? And I think it's great. It's a much more vibrant ecosystem on the right. I know you're apolitical prior to 2020, but my goodness, there's so many different offshoots. But the left, they are so monolithic when it comes to whoever. It doesn't matter. It doesn't matter who they put up, right? They could put up, I don't want to get in trouble. Yeah, never mind. They could put up some wackadoo person who, they could put some wackadoo person who's having orgies during the COVID pandemic. But the moment this person is the appointed pick, they all fall in line and they're just like, okay, this is the person. So Vivek Murthy, do you remember Vivek Murthy, the former Surgeon General?
Oh yeah.
Oh my God. Like here's a guy, tons of pedigree. He's, Brigham, he's practicing internal medicine. And during that whole process of getting appointed and going in front of the Republicans and stuff, this gets to your point about the uniparty and whatnot, right? It came to light that he made more than $2 million doing pandemic consulting speeches, right?
Really?
Yeah.
Oh,
so he was talking to, he was giving, Airbnb and other companies were giving him lots of money. I think there's some Carnival cruise line or something. Clearly they're giving him money because they know that he stands to have a certain position. And this is the chief doctor. He's going to have some opinion on whether or not cruise lines are accepted from this craziness of lockdowns, right? And it's clearly, I mean, look, I'm, speculation. It seems off. All right. But the guy sails through, nothing happens, right? He has tweets literally is talking about how, gun violence is a public health, and we, basically intimating that we need much tighter gun control and stuff. And again, none of that matters. The left and the right are just like, well, he's the nominee. Let's just pick.
Right.
So, and he of course goes on to be, as predicted, horrendous, right? The most dangerous thing I thought he did was when he decided that, the biggest public health threat to America was misinformation. He probably saw a tweet of yours and was like, you know what, we got to stop talking about it.
Well,
So I mean,
yeah.
he literally said, I don't know if you remember this, he had this whole 35-page or 22-page thing. And then in that, impregnated somewhere in there on one of those pages was, what should social media platforms do? And literally says, let me read what technology platforms can do. Prioritize early detection of misinformation, super spreaders, and repeat offenders. Impose clear consequences for accounts that repeatedly violate platform policies. Oh my goodness. The Surgeon General is basically telling, the government is telling tech platform, and we know they were doing this through Andy Slavitt, etc. They were basically saying, hey, we are going to decide what information comes out or not. To me, Casey means, she's clearly leagues better
Well,
than
yeah.
any of these people. You know what I mean? So why does the right not just get in line and be like, all right, at least it's not a Marxist or a communist?
Well, she is not aligned at all with COVID. I mean, that's my
Okay.
beef. How could I support somebody that doesn't that wants to sweep the pandemic under the rug? I mean, that would be highly disingenuous of me if I were like, yay, to this woman that doesn't want to talk about COVID at all. Right. I mean,
Right.
historically or presently.
Right.
I mean, I could forgive her if maybe it was a political move and historically she had spoken out about it, but she authentically does not care about the pandemic.
You
And so
spoke
I just
to
can't live with that.
You spoke to her brother, correct? At
I
some point,
interviewed with him. Yeah, we did an interview
right?
to get about a
With the very interesting Dr. Cruz, who I've never met. He's a very fiery individual. I'm scared of meeting him. I don't think. But what was that? What was that? What was that like in terms of chatting with the brother of Casey Means?
Yeah, I mean, so I don't know if you remember the timeline of all this, but they kind of parachuted in, like no one had really heard of them. And then all of a sudden, they've got a best-selling book. They're on Tucker, they're on Rogan, they're best friends with Kennedy, and Kelly convinced Kennedy to drop out of the race. It was right after Trump was shot. He said that he had this, light bulb go off in his head, and he decided to bring Trump and Kennedy together and convince Kennedy to drop out of the race. And so, in our group, our thought is, well, this is a distraction technique. This is a way because his focus is on food and all that. And this is a way to distract from COVID and the mRNA shots. And, there's all sorts of theories on, is he CIA and all that. But, it's worked. The HHS is not talking about COVID. So they're talking about food.
So what the dream HS, like what they should have done? What would you have done? What would they have done so far?
Pull the shots off the market. I think they should make ivermectin over the counter because all these states are passing legislation and it's ridiculous. It's very safe. People are going to the feed store. They're buying it from India. Just make it over the counter. I mean, it's incredibly safe. I think they need to repeal the PrEP Act because the PrEP Act, no one can litigate over anything thanks to the PrEP Act. I think they need to make vaccine manufacturers liable just like any other drug company. And I think they need to eliminate all medical mandates. I mean, this is a wake-up call. I never even thought about the childhood vaccine schedule. I just went along but that should be a choice. You shouldn't have to be punished or, risk your job or your education because you don't want to get something injected in your body or in your child's body. So that's my wish list, and none of those have been done.
Yeah,
All right. Well, we
definitely agree with the repealing the mandates. Still bitter about all of that. I think going back to kind of your earlier battle, the physician versus the health system, I guess what would Secretary Bowden do to empower physicians to be on an even footing? Since you've gone through all this, I think your perspective is incredibly valuable. So what would you do to give physicians more power against these large health systems, against state boards?
Well, it's financially risky to be an independent doctor, so they could give some sort of financial incentive, some sort of financial package to make it easier to become an independent doctor. I think they need to take power away from the hospitals. I mean, these nonprofits they're fleecing us. They're making healthcare expensive for all of us, and they're raking in the money. I mean, Methodist Hospital, I looked at all the nonprofits in the state of Texas. They were the number one in terms of income. And you look at the top 20 nonprofits, and I think 16 of the top 20, they were all hospitals, right? And they're building these just gigantic facilities everywhere. They're sponsoring the Astros. They're sponsoring the Texans. They're sponsoring the ballet. There are billboards everywhere. There's ads everywhere. I mean, it's crazy. So, in terms of specifics other than that, I mean, I think the price transparency is a big thing. I mean, I have all my prices on my website. It's very easy. The hospitals have figured out a way to make it very difficult. They put the prices on there, but then you have to have a special program to interpret them. It's not straightforward at all. I think that HSA funds that should be available to everybody. I think people need to be educated about how to buy insurance and how to use it. I mean, people don't really understand. I still don't even understand my policy, so it's so complicated. But yeah, I think I don't see the current system really imploding anytime soon. But maybe we just need to build up the independence to offset that. And one thing I interviewed the founder of Crowd Health. I don't know if you know about that. I
Yeah.
thought that was very interesting. I'm going to really consider joining that. I don't know if you have experience with it or.
Yeah, no, have you guys heard about it? It's an interesting thing where you put out there, if you have a medical need, you put out there what you need, and then a bunch of people will attempt to help, chip in. It's almost like you're running a GoFundMe every time you have something happen. But obviously you feel inclined to do that because if something happens to you, then you're going to need money from the crowd. So it's a super interesting, cool way to kind of go about doing it. And it seems like they've had some great success. You have a great podcast that you're doing right now. Your podcast that you do is the name of it is
On Call with Dr. Mary Talley Bowden.
right, On Call Dr. and it's sponsored by the Wellness Company, correct? That's who is the sponsor band, or is it your thing on its own?
I've been doing it for 6 months, and I have 2 sponsors, but I've decided to go sponsor free. I don't know.
Wow. I love it.
I'm learning a lot about all this.
Yeah, I'm
And
sure. Yeah.
that's all I'll say. But it's been good. It's been very, very grateful. But I just think I'm just going to do my own thing.
That's awesome.
And
I'm
independent to a fault, I think.
Yeah, exactly. I was
All of us here.
yeah.
Love that.
Sorry, they had one thing. Dan, you hold that thought. You had a great interview I saw with just to go back to the hospital systems and how just so the public knows how dirty the hospital systems can be. I caught a great interview that you had with a gastroenterologist.
Oh, yeah.
Who
And
was
they do
fighting.
apologize.
Yes, who was fighting the vaccine mandates, right? And he did not want to get a vaccine mandate, attempted to get an exception, a religious exception or something like that. And they refused, and he got taken off. His privileges were revoked, right? And fascinatingly enough, they said, well, that's the laws, that's the bylaws, blah, blah, blah. And fascinatingly enough, his brother is an interventional cardiologist. And, because, that guy butters their bread, he still has privileges, right? So you can see these health systems are just so dirty. Like they use all these different rules, they apply them differently based on who they want in and who they want out, right?
I've said that all along. Like if I were chief of cardiothoracic surgery at Houston Methodist Hospital, they would not have gone after me, but I was expendable. So
right,
yeah.
Exactly. They want to make an example with you, and they want to send a message. Sorry, Dan, go ahead.
Dr. Bowden, when I hear about your story and the hardship you endured in the last 6 years, I'm sure there were moments when you looked at the fork in the road. You said, I can fight back, or I can just let this go away and stay in my world of your practice, private practice. Look, I try to be vocal, but I also look at the fork in the road. I usually choose the safe road. I say, well, I'm going to hire these, during the pandemic, when there was a vaccine mandate, there were a lot of nurse practitioners, there was medical assistants that got fired from the hospital systems, usually younger female who were worried about fertility. They had heard, and they basically said, I'd rather just not be unemployed. And our practice employed them, right? That was a very safe way of me saying there's some injustice here. Hey, our practice is going to take you guys in with open arms because, look, we don't have mandate. Just wear a mask. Wear a mask. That's fine. Okay? You're not at risk if you wear a mask. Let's use common sense. Okay? But you took this, I would say, courageous road of the path less well taken. So what is your personal philosophy that drives you to fight? What goes on in your thought process to say, I'm going to take this other road?
Well, I grew up with 2 older brothers, so I think I'm wired a certain way to, like, just fight. I don't know. I saw everything firsthand, and
When you go
when I
skydiving, do
I do
you
not
have an
skydive.
emergency parachute, or you're just like
No,
no
I
emergency
don't
parachute
skydive.
needed?
I do love roller coasters, but I do not skydive. But I think what I like if I hadn't seen all this firsthand, I don't think I'd probably be quietly doing my own thing right now. But it just kind of came to me, and then when Methodists came after me so publicly, I was so mad. I mean, it was spite, I'm still driven by. I still want to win this. I'm still mad about it because I'm seeing all this firsthand, and my intentions are very good, and I'm trying to help. I'm not, and money was not a factor. I don't need the money. I didn't need to work. I went back to work because I wanted to work because, I had 4 kids and they were in school finally. And I'm like, well, I'll start back and I'll do it on my own terms. And I don't know. It just saw it all firsthand.
Yeah, there's something special in the Texas water or something because I've watched this kind of go on and there's so many ups and downs to the case, and there are times where you're down and it seems like the TMB is winning. Like I've logged on to your live hearings and it's like, my God, this lady is so pugnacious and she won't back down ever. It's like, anyway, I look forward to the movie featuring you. So what actress should play you? That mixed martial arts person? And so anyway, we've taken up a lot of your time. We're about an hour in, and I know you've incredibly busy, and I don't know how it is you do everything it is you do. So thank you so much for coming on. We'll edit this lightly, mostly to get rid of my ums and ahs, and then we'll put it out on Spotify, Apple Podcasts, and YouTube. Again, the show that you do right now, just say again, it's On Call, and does it come out live at a certain time, or just throughout the day, or throughout the week?
Yeah, well, I'm working on that. I
Okay.
mean, it was doing every Wednesday at 12:30 Central, but now I don't know. I just kind of post it when I feel like it.
Okay.
But I do want to plug my book because I have
Oh,
a book
yes.
coming out.
Please. Okay. Yes.
It's called Dangerous Misinformation, the Virus, the Treatment, and the Lies. It's coming out in May.
You should send a copy to Vivek Murthy and have him write a foreword on. That would be hilarious.
I just sent an email to my patients. I said, please send a copy to Mark Boom, who is the CEO of Methodist.
Okay. All right. Fantastic. Well, thanks again. Your Twitter handle, total fire account. I swear, like every 6 months, I have to refollow you because I'm like, what the heck? Why am I not following her?
Yeah.
What your Twitter handle is at Mary Bowden MD. So
right.
Yeah, so definitely a must follow. And again, best of luck. We're all rooting for you. Certainly, independent physicians and really all physicians alike should be rooting for you in your fight against the monolithic Borg that is the local academic health system. So thanks again, Mary. All right.
Thanks for having me.
Yep.
Thank